Imagine this. You're in the hospital, thinking you're finally on the mend, when all of a sudden, things take a really terrifying turn. What should have been a routine stay becomes a fight for your life, and the doctors are just scrambling for answers. Today, we're going to dive into a medical mystery where the real culprit was hiding in plain sight the entire time.
So, this is the big question at the heart of our story. Most of us walk around carrying all sorts of viruses that are totally harmless, just dormant in our bodies. But what happens when one of those sleeping giants decides to wake up? We're about to find out how a common little passenger in our bodies can suddenly turn into a very, very dangerous hijacker. Okay, so let's set the scene. Our story starts with a patient who's already in the hospital. They were admitted way back on July 31st, and for months, everything was more or less under control. But then, one day, everything changed. October 19th. That's the day the crisis hits. The patient has a massive gastrointestinal bleed. Now, we're not talking about a small issue here. This is a huge amount of blood loss. It's a full-blown medical emergency that needs immediate action. The stakes couldn't be higher, and at this point, nobody had a clue what was causing it.
To figure out what in the world caused this bleed, the medical team had to basically become detectives. They started digging back through the patient's chart, hunting for any clues in the days and weeks leading up to this crisis. And, well, they found something pretty significant.
Looking back, the first clue was right there in the data. For weeks between October 13th and the 27th, the patient's hemoglobin levels were consistently low. You can see them bouncing around between 7.3 and 8.9. This pointed to a persistent, nagging anemia. While it wasn't the direct cause of that huge bleed, it was a really critical piece of the puzzle.
So, what is hemoglobin anyway? Well, think of it as the delivery truck for oxygen in your body. It's the protein in your red blood cells that grabs oxygen from your lungs and carries it everywhere else. When your levels are low like this, it's a big red flag that something is simmering under the surface and your body just isn't getting the oxygen it needs.
After that emergency on the 19th, the investigation really kicked into high gear. Once the patient was stabilized, the search for the root cause led the team to look for some more unusual suspects, beyond the typical things that cause GI bleeding. And what they found was a total shock.
On October 22nd, just 3 days after the crisis, the blood tests came back, and they revealed the culprit, a virus called Cytomegalovirus, or CMV for short. Now, finding CMV isn't actually that strange. Most adults have it. The shock wasn't that the virus was there. The shock was the sheer amount of it.
The patient's viral load was over 2.3 million international units per milliliter. I mean, let's just let that sink in. That is an absolutely astronomical number. This was the smoking gun. This wasn't some dormant virus just hanging out. This was an active, raging infection that was completely overwhelming the patient's system.
So, the team finally had their culprit. But how could a virus that's normally so common cause a life-threatening bleed? To get that, we need to understand the actual disease it was causing. The patient was diagnosed with something called CMV viremia. That's the official term for when the virus isn't just sleeping anymore, it's awake, it's actively multiplying, and it's circulating all through your bloodstream. For most of us, our immune system keeps it locked down. But for this patient, something had gone terribly wrong.
And here's the absolute key. CMV can wake up and reactivate when the body is under immense physical stress. Think about it, a really long hospital stay, maybe recovering from a major surgery. All that physical stress weakens the immune system's defenses. It's like leaving the front door wide open. It creates the perfect opportunity for a dormant virus to roar back to life. And in this patient's case, the reactivated virus went on the attack, targeting the gastrointestinal tract, causing these deep ulcers that eventually led to that catastrophic bleed.
So, with the mystery finally solved, the medical team could at last target the real enemy. Naming the disease CMV viremia was the absolute turning point in this patient's long, difficult journey.
This timeline really tells the whole story, doesn't it? The patient is admitted way back on July 31st. The crisis explodes on October 19th. But just look how quickly things turn around once they solve the puzzle. The diagnosis comes in on the 22nd, and with the right antiviral treatment, the patient is stable enough to go home just 8 days later on October 30th. That is a truly remarkable turnaround.
This case is just such a powerful reminder that sometimes the biggest threat is an enemy we're already carrying inside us, just waiting for the right moment to strike. And it leaves you with a question, right? In the incredibly complex world of medicine, what other hidden culprits are just waiting to be found? If only we know to look for the unexpected.